I'm Shannon Clark. I've committed my career thus far to reducing the amount of human error in the medical space through better designs for medical devices, instructions for use, and training programs. I started participating in international and national standards committees in 2013 and have provided a lot of input for IEC 62366. I've also presented at the Food and Drug Administration. I founded a human factors consultancy in 2014 and sold it in 2022. I'm no longer affiliated with a company, and the opinions in this video are expressly my own. Back in 2013, when I was contributing to HE75, the conversation in the room was about deferring blame from the user and making sure that companies took responsibility for the fact that if you don't conform to societal expectations of how something should be designed, you can set a user up for failure. For example, if you put the gas pedal on the wrong side for a surgical robot, these are ways where the design can actually set up the user for failure. Before 2009, approximately 2008, the FDA really wasn't enforcing this area, and we've made great strides to reduce human error in this space through better designs. And that's what I've been doing for the past decade, conducting usability studies, observing users interact with these novel prototypes to uncover what sort of errors might they make if this were sold in the field, and change the design before it's sold. So I'm really excited about what we've accomplished as an industry, but the purpose of this video is to send a message that I am very concerned about the way the FDA is currently enforcing human factors. Back in 2013, 2010, when I joined the industry, the biggest threat to patient safety in the United States from a human error perspective was companies ignoring it. We've come so far. Companies now understand that they need to take accountability for human error and consider it as an input to the design. But I believe the biggest threat to innovation today is starting to become the FDA itself. Some of my colleagues believe that the FDA has just gone off the rails, but I see exactly what the misunderstanding is that's happening, and it needs to be righted. The first fact that we should all align on is that perfection in engineering is impossible. Even a spaceship sent to Mars or the moon is only going to be 99.999% reliable. It's impossible to engineer to perfection. There's always going to be some level of risk associated with any medical device or product. It's unrealistic to expect humans to interact with devices perfectly. Even if you have perfect training programs and perfect instructions for use, there are always going to be some inherent device issues that you have to weigh against the risks of that particular device and its benefit. At some point, a company or the FDA, as you're examining a medical device, needs to conclude whether something is quote unquote safe enough. The problem that is occurring right now with the FDA enforcement is that the line where we define safe enough is completely unclear. It's blurred to the point of causing huge delays to product to market and confusion amongst all human factors engineers throughout the world. In my opinion, safe enough should be one line. It shouldn't be multiple lines. Safe enough shouldn't be defined differently for a startup than it should be for a Fortune 500 company. Safe enough is a line that should remain the same whether you're an FDA reviewer approving a medical device or clearing a 510K, or an FDA auditor issuing a 483 observation for an on-market medical device. We should hold all devices and companies to the same standard, and we should define it clearly and transparently for the American public. Without transparency in regulations and enforcement, we have no hope of efficiently bringing life-saving medical devices to market. So this is where I'll get into the weeds for those human factors engineers who really want to understand the crux of what I'm talking about. In 2018, the FDA presented at the Human Factors and Ergonomic Society Medical Device Symposium. At the symposium, they highlighted the importance of 21 CFR 803.3 Part W. This is a regulation relevant to complaints management. It's the concept that if there's serious injury associated with a complaint, then it's a certain type of complaint. They define serious harm as an injury or illness that is life-threatening, results in permanent impairment of a body function or permanent damage to a body structure, or necessitates medical or surgical intervention to preclude impairment. They identified that a critical task should be defined by serious harm. So when we practice human factors, we select critical tasks following a risk management process. We test the critical tasks in human factors validation, where we simulate use of a medical device. And then we assess whether users were able to complete the critical tasks without causing serious harm to patients or themselves. The problem at hand is that the FDA is no longer honoring this regulation or associating it with human factors practice. They are now considering a wider umbrella of all harm. Let's walk through two scenarios. In scenario A, we consider all harm to be unacceptable. We have a blood pressure cuff. We're conducting human factors validation testing. A participant receives a paper cut upon opening the package. Is this a critical task? Well, harm occurred. Yeah, I guess it is, if we're not going to comply with that regulation I mentioned. As a result, they've failed human factors validation, and the medical device company must pay at least $50,000 in order to conduct a new human factors validation study, not to mention having to source prototypes, and a 4-month delay. For a startup, this could be a death sentence. Now let's consider scenario B. We consider serious injury to map to critical tasks. So if someone receives a paper cut or almost receives a paper cut during the human factors validation, that product doesn't quote unquote fail human factors validation. The company can use a risk-based approach to assess the scenario, and most likely they're going to immediately take action and address the product defect. They don't want to have to manage a bunch of complaints in the field associated with this. Or more likely, they're going to submit the data to the FDA, wait 90 days for their clearance for their 510(k), and then in the meantime, make improvements to the packaging. So by the time it does come to market, it's been improved. In scenario A, if we consider all harm to be unacceptable per the FDA standards and in human factors validation testing, then the worst consequence is that once that product is on the market, and once there are other product defects that the company is made aware of, they might be slower to take action to improve the product because they know that every time they make any change, they have to conduct a human factors validation study, which again is very expensive and takes a minimum of 3 to 4 months. This is what I mean by the FDA making these devices less usable and less safe by not honoring 21 CFR 803.3 Part W and mapping that to the definition of critical tasks. Again, in engineering, it's impossible to design a perfect device. So we need to draw a very clear line as to what is safe enough and what is not safe enough.